this week, I would say this month, APPNA MERIT webinar, which is today. I'm very glad and happy that one of my mentor, my teacher, who I get always inspire, is here to present about community-based strategies for improving maternal and child health, the PAHCHAAN model, which I got recently introduced to, and I'm very, very inspired by the work Dr. Naeem Zafar and his team is doing. Just to let everybody know about Dr. Naeem Zafar. Dr. Naeem Zafar is a community pediatrician with over more than 25 years of experience in child right and protection, an area which is very much needed in Pakistan. And I think because of his and his team effort, we see a lot of changes and reforms in this space in Pakistan. He's a president of PAHCHAAN, convener Child Right Group, Pakistan Pediatric Association, chairman, board of director, Pakistan Alliance for Early Childhood, and member board of director, International Society of Social Pediatrics and Child Health. He initiated first hospital-based child protection unit in South Asia, expanding to child protection network in 20 districts. He also established the first academic child right department in South Asia at the University of Lahore in 2016. He's currently establishing mother and child health promotion center in underserved communities, and I personally visited there, and like I have tears in my eyes, and I continue to think about it for many, many days. And I was like, I was literally very touched by all the work which is happening to provide holistic health, nutrition, nurturing care, and protection services to the most disadvantaged families. And when I say most disadvantaged families, they are actually most disadvantaged. There's sometimes no electricity, no other basic life facilities are still present. He received first PPA President of Pakistan Community Pediatrician Award in 2020, an International Everyday Hero Award by ICMEC USA in 2021. He has authored many articles on child protection, conducted national and international training, and organized conferences on child health and child right. So without further due delay, I will hand over the forum to Dr. Naeem Zafar.
I'm so grateful. Thank you very much, Jabin, for giving such an elaborate introduction. I am just a student of community pediatrics, and I'm trying my bit. So what I can do, I'm extremely thankful to APPNA MERIT, and especially Dr. Akhtar Hamid Saab and Uzair and Waleed for coordinating it under the difficult circumstances. And obviously, all due credit to Jabin Fayaz for taking this, the community effort that we are doing to an international level. So with this, I'll just be talking. Today, I will be talking about my the work that we are doing in the communities of Punjab province of Pakistan, but we plan to extend it all over Pakistan. And this is a community health model, nothing new. Most of the countries are already doing it. Unfortunately, in Pakistan, we are all used to talking about the state-of-the-art centers, the big hospitals, and the largest hospitals in the country and in the Asia and South Asia. We just forget what is happening in the communities. So that is where I'm going to start. And please bear with me because I will be talking about some very, very basic things. So if I start with my first slide, and if I can, I don't know if I have the capacity to ask the people, but I will just take a pause here and let you think about this particular picture. So what do you see here? If somebody can answer from the audience or put it in the chat, I will take it, but I'm not very sure about that. I'm not a very
Yes, they can write down in the chat and I can read the chat for you if you want.
So, so I would like to know, what do they think? There is something which is visible, but there is something that they need to think why I have put this picture here and what does it depict. So I get from Umul bin Benin, Rizwan, and she says these are stages of life, cycles of life. Uzair thinks that it takes a long time to get the fruit and you need a lot of care to do with that. Yes. Any other ideas? Of course, it is a stage of life and it does take time to get fruit with care. Any other ideas here? Future figures. Seed needs environment. Excellent. So what I'll just, okay, patience to have fruit. What we are talking about actually is a life cycle. And I'm going to start this life cycle from the seed here, and which goes to, from a seed, it becomes a small plant, becomes into a tree, which bears fruit, and the fruit again has a seed. Now, the most important thing is, I would like you to consider this seed as a baby. So when the seed is sown, it is in the mother's womb. So it is the time of conception that we are talking about. So this, from this time onwards, this is the life cycle of the child, right from the mother's womb till the time he or she comes out as a small sapling here, as a small baby. That sapling then grows into a larger child, ultimately into an adolescent, a small tree, and then an adult, a full tree, and then bears fruit, which is the next generation. But what is most important here, which I need you to see, is what do we need here? So here we need the soil, because you know and I know that without soil, the seed cannot survive. Allah Ta'ala in the Quran Sharif says that we have made man from the best of creations. So I am assuming that all the seeds are themselves healthy. I'm not talking about an occasional or a rare disorder, familial disorder, or a genetic disorder. I'm talking about the normal children. So a majority of children, the seed is perfectly normal, but what it needs is the soil. The soil has to be moist, it has to give warmth, it has to protect, and it has to make this seed into a small sapling. So the mother's womb here, the ma, dharti ma as we call it in Urdu. So this is the most important area, and this is not just going to happen while the baby is in the womb, but even later, till the baby is an adult even. So that is the most important, the importance of the mother. The other important thing is, which you would note is the sun, the environment. So if it is very hot, it's not going to survive. It's very damp, it's waterlogged, as we see in these floods. Again, it's not going to survive. So it has to be the right temperature, the right environment. That environment is given mostly by the father. The protection, if this particular seed, how does it go back? I don't know, I did something wrong. So can I take it back a bit? Yes. So if this seed does not have appropriate support from the father, again, it will not survive, or the fruit will not be as good. But it also needs the other environmental factors as well. It needs protection. A squirrel can come and eat it when it is very small. So it needs protection as well. So what we can infer from here is that it takes a village to raise a child. So whenever we are talking about a baby, we cannot take the baby in isolation. We, the pediatricians, we know from our work that a child can never be taken into isolation. We have to consider the mother, the father, the whole family, the peers, the influence from the grandparents, the other relatives, and actually the whole community. So this is one concept that I need you to understand before I move to the next one. And the next one is even more difficult. So I will again refer to some questions. And what do you understand by the phrase first 1000 days of life? So what do you think? What do you think about that? The first 1000 days of life, as I told in the previous one, is the pregnancy, the first year, and the second year. 270 days plus 730 days make the first 1000 days. We have been listening about the first 1000 days for quite a while now. WHO talks about nutrition in the first 1000 days. People talk about development in the first 1000 days. Why is it the first 1000 days the critical window of opportunity? You need to know that. That is what I'm going to tell in the next couple of slides. Just look at this anthropometry at 2 years. Now, if you remember, at the time of conception, the weight is 0, the length or height is 0. Obviously, the head size is also 0. The brain is not formed as yet. So at the completion of these 1000 days, the weight is still 12.5 kilos, which is about 17% of the adult value. But what is most important to note is the length of the child or the height of the child. The child has attained half of his or her height by the time he or she turns 2 years. So these 1000 days, 50% of the height is already achieved. So when we talk of stunting, when we talk of stunting in Pakistan, when we talk of 40% stunting in Pakistan, this is the age where this stunting starts, and this is probably the age where the stunting hits the worst. So this is what we need to know. Unfortunately, the story doesn't end here, because the head circumference, almost 90% of the head circumference is achieved in these 1000 days. And what does that mean? It is not the head circumference which is important. It is the brain inside, because the head will only grow with the size of the brain. So the almost 85 to 90% of the brain is developing during these 1000 days. Now that is the most critical, important period. Why? Because in this period of time, the connections, the dendritic connections are going to be made. I don't need to reiterate. People know that no new neuron will be formed after the age of 18 months. So new cells will not be formed. After that, it is only the dendritic connections. And these neuronal connections are also mostly made during these 1000 days. And after that, it is the pruning that takes place. Extra neuronal connections, non-required neuronal connections are actually pruned. And then we have the 10% increase over the next 18, 20 years. And most of this is already done by the age of 2 years. And this is what is the difference between the sizes of the brains at 3 years, the normal brain, and an extremely neglected brain. So you can very well imagine that if the child is not taken care of during these 1000 days, what is going to be the end result? Now, let me place a simile with the computer. So if you're talking about a computer, the hardware is the brain, and the software is the programs that you are running on it, is the life experiences and the intellect that comes afterwards. Just imagine, instead of a gigabyte hard drive, you have a hard drive of a few megabytes. So what are you going to do? You can't run heavy programs on it. And that is why we say that if the child is not taken care of during these 1000 days, as far as his or her health, nutrition, nurturing care, stimulative environment, and protection is concerned, the result is you cannot have an engineer, you cannot have an entrepreneur. All you can have is a babu or a clerk or a skilled or a non-skilled worker. And that is exactly what Pakistan is producing right now. Our intellect is just here and there, an occasional stroke of luck. The rest is all mediocrity. So with this, I move to my next slide, and that is that what do? We take care of these children in the first 1,000 days with the help of the community. We also take care in the next 1,000 days, which is the time where we are providing them with nurturing care, and then the pre-adolescent and adolescents. Let me move to another. Now, this data comes from the government of Pakistan. And according to this, if you look at the trends, the mortality trends over the past 30 years, 35 years, they have shown a decline in the under 5 mortality and the infant mortality. We can have a lot of discussion that this is not enough. Yes, it is not enough. We needed to do better. But the worst part is, look at the neonatal mortality. That has not gone down at all. Virtually not there. So even if you look at the provincial neonatal mortality, and Punjab seems to be doing better, but what you see is that it's almost a flat thing. So we are not getting anywhere. The neonatal mortality is not declining. So we need to find some new reasons why it is not happening. It's not only because of the first 1 hour or the first 1 minute or the neonatal dyes and those. It has to be more than that, much more than that. We have to invest in the communities, and I'm going to tell you how and why we are going to do it, because this is the reality. And what Jabin was referring to when she said that she had tears in her eyes, this is the mortality in the community that we are working. If you are looking at your computers, you can read the date of death here. If you're on the mobile, it may be a bit difficult, but look at the dates. Now, if you look at the upper row, there is a long grave, which is of an adult. And there are 2 short graves, smaller ones. These are the children on the right and on the left of that. And in the lower row, where there are 2 names to a board, these are actually all children deaths. So I haven't seen anywhere so many graves of children or newborns or infants. And if you look at that, just look at the date between the 19th of April 2023 and 28th of April 2023, over a period of 10 days, you see 8 deaths. What are you talking about, the neonatal or the infant mortality? In 1,000 live births, look at the rate in one small community of 50,000 people. All these statistics are insignificant here, because here we are talking of life and death. And when we talk to these people, when we talk to them why these children died, they said there is no health facility. When the baby is born, if we get the baby alive, we thank Almighty Allah. If he is not, we return it to him. If the mother survives, it's our good luck. If she doesn't, we can't do anything. That's the kind of thing that they had. That's the ultimate apathy, or I won't call it apathy, but it is just they couldn't do anything. Lachargi, as we call it in Urdu. I don't have a good word for it in English. I'm sorry, I don't have that. But that's when we started our work. And this was after this, we started our work in June 2023. Things are a bit better, but not to our liking, obviously, because we cannot control the other factors. We are only providing them with clean water and health facilities. Another aspect. Let's talk about stunting. I just talked about stunting, that there is almost 40% stunting in Pakistan. When we talk of provincial stunting, now this is again government data, we see Punjab is doing much better. We only have 30% stunting, which is obviously much more than the rest of the world, but at least in Pakistan, we are very good. Again, it's false, because in the next slide, you see that it is only good in the highest or the wealthiest population. This is again the Pakistan official survey. And in the lowest quintile, the stunting is more than 57. So almost 60% of the children are stunted in the poor environments. We are not looking at them. We are sitting in the hospitals. We are looking at the population who can reach the hospital. But who can reach the hospital? Can she reach the hospital? This woman had a little child who was 6 months old. That child came to our hospital-based child protection unit. As Jabin just told us, that we have developed hospital-based child protection units in 20 districts of Punjab. In one of theirs, this particular baby was brought severely malnourished, anemic, pneumonia, and the baby could not survive. And we labeled the child as willful neglect on the part of the mother, because she was not there even in the hospitals at times. So, but when our community mobilizer went to see this particular woman in her own household, what he saw was a house where there is no door, there is no roof. It's an under construction room in an under construction house where she has this. And this particular box is her saving, where she puts the atta there. And she has 2 children to feed, and she has to work for them. So she has absolutely nothing else to do. How could she take care of that particular child? Her husband is not there. So these are the harsh realities of life. So instead of calling this willful neglect of the mother, I'll call it systemic neglect of the community where this has happened. Why did she not go to the hospital? That's the question. Why the children do not go to the hospitals till it is too late? You and I, while we were hospitalists, I've always been a hospitalist in my times. We always considered, why do they bring the child at the last moment? Why can't they bring the child earlier? But this is again our PSLM survey of the government, which says why people do not visit the hospitals. So either there is no government facility nearby, or the doctor is not there, or the staff is very rude, or it's too far, the access is too bad, but ultimately they cannot reach. And so what happens is, the caregiver's perspective says that the financial burden is going to lie on the person. So it is the expense. They cannot go to the hospital because they have to lose their 1 day of work. They have to spend a lot of money, and they will not be taken care of. So why should they go to the hospitals? They go to the nearby quacks. They could go to the nearby doctors. They go to the nearby hakims or whosoever, till such time that they have to go to the hospital and it is already too late. So this gap we have to cover. This gap we have to cover, because otherwise what we see here is a government hospital nursery in Lahore. Sorry, it's not in Lahore, it's in Pakistan. Disclaimer, it's not Lahore. So saying thereby, would you expect a neonatal intensive care or a mid care as well like this? You always talk of intercurrent illnesses. You talk of hospital-acquired infections. How can you take control of this? This is what is happening in the hospitals, because the patients, the overload is coming to the hospitals. the communities are not being served. And when the government says that they are providing services, look at the quality of services that are given. Now, this is the services to the mothers. And again, this is government data, this is not mine data. And what are they providing? 10% intermittent preventive. Even the iron supplement is not given to 50%. The antenatals is given to almost half of the women. So somebody has to come forward and tell them that this is not going to work. So what we did is we have started doing a pilot. So these are the images of the first, our center, which is in the heart of the community, where we have these people and where we serve them with our lady health visitor and a midwife and a doctor supervising 5 of such centers. It's a low cost model costing just about 500 rupees per visit. And what are we providing in those 500? You can see the services that are being provided. We are providing them with medical, antenatals, postnatals, a well baby clinic, breastfeeding, vaccination is through the government. Once a week, the EPI comes in and vaccinates. We provide them growth monitoring. Each and every child that visits these dispensaries or mother and child health centers, they get their weight, length, head size, and mid-arm circumferences. And the women also get all that. We provide them with nutritional advice. We provide them malnutrition management through the courtesy of the Trust for Malnutrition and Stunted Growth, TMSG. We are providing them with RUTF. We are providing them with micronutrients. We are also providing them with clean filtered water with the kind support of APPNA. We are providing them hygienic practices. Family planning services are also given. The nurturing care is provided, parenting. We are talking about child safety, safeguarding, and health awareness. Talking about the family planning, we were working in the Afghan refugee areas. And would you imagine these messages that you can see on the outside, these were, I purposely did not put any family planning because otherwise nobody would dare come in. They have 2 to 3 wives, 14, 15 kids. These are the Afghan refugees settlements, which are now actually being moved by the government. So here, our first success was that after 6 months, my lady health visitor comes and reports, "Sir, today we had a woman coming in for family planning." So after 6 months of their home visitation and their continuous telling those, then the family planning services have started, and now we are providing them family planning services to the communities as well. But what I'm going to tell you is the cost of one visit is 500. Now let's imagine 4 visits are required for antenatal and almost 4 to 5 or 6 visits during the first year and 2 or 3 visits during the second year, a total of 12 visits during the first 1000 days that I described. And what is the cost of these visits? 6,000 rupees only, 22 United States dollars, which makes or breaks a child. So this is the lowest cost model that we can make for improving the health and the development and the intellect of the children. So these are the kind of children that we are working. So here we can see what is actually happening in the communities and what we see in the hospitals. That is the stigma that we see. If we talk about breast, I'm just going to give a couple of examples of how we are doing it. These are the status, this is the statistics of Pakistan's breastfeeding by age. So exclusive breastfeeding at 5 months is close to 30%. If you see where these arrows cross, the blue and the green, you see at 5 months, its exclusive breastfeeding is 30%. And what do you see here? Within 6 to 8 months, we went up to 65%. And the next year, now exclusive breastfeeding at 5 months of age in our communities, thanks to our community mobilizers, is 83%. Similarly, talking about the vaccination, the overall vaccination status in Punjab is better. But as we see, it varies from community to community. But here, we started off with almost, in a few months' time, we took it to 90%. Now we are talking about 94%, 96%, which is actually the tip off, because at 95%, we are talking about the herd immunity. So this is where we are going right now. We don't have any tests over there. It's a very low cost model. We do not have any labs. We do not have any ultrasounds. We do not have any diagnostic facilities. So the women come in with problems of generalized body aches and talking about their problems. So this was what they had in 23 versus what they have now. So this is only because of the micronutrients, the iron and the vitamin D that we provide them, they have improved. Now we have these centers. We have 5 operational centers in Lahore, Kasur, Kotaddu, and we have under construction centers in south of Punjab, and we have some centers which are on the way. But I'm going to tell you a little bit more about it a bit from now. These are the centers which we are working. Each center is supporting about 30 to 100,000 people. We are trying to gather data. We are not experts in statistics. We are not researchers, but we are trying to get as much data as possible. And I invite you all to come and work with us on these, because this is what through the water we have made changes, through the community what we have made changes, and how we are going to do it. And this is not expensive. We, in our recent visit to the US and to the Canada, we have got good support from the APPNA Pediatrics, from the APPNA community, and from the other doctors in the community. And we have pledged for 5 more centers, and which is not much. We only have to spend about $18,000 for a year. So just about each one center would cost around 500,000 rupees a month for almost 15,000 visits. So this is the kind of thing that we are doing. Unfortunately, we were trying to settle in, but came in the floods. Now the floods have devastated. These are the pictures that I took a couple of days back. I was in the Jung and Chiniot area 3 days back, and that is what I have seen over there. And PAHCHAAN is providing rehabilitation services to the communities in 6 districts. And unfortunately, or maybe fortunately, it's an opportunity for us. 6 of our centers are located in these flood affected areas. So out of the 10, the 5 constructed and 5 under construction, we have 6 areas in these particular areas. So what we thought of a plan to work in these and work with them. So what we are doing is we are providing them with mental health sessions, including the psychological first aid, the group therapy, and the individual therapy through UNICEF support. We are doing a project with them. They are also providing with child protection mechanisms in these hospitals. We are working with the government and with the UNICEF over there. Play and art kits are also provided with them. But then to add value to it, we are working with the other organizations, with the government, with the non-government organizations, with Pakistan Pediatric Association, with our friends. So we are providing medical camps and medical supports in our medical centers. We are providing them nutrition through the RUTF and the micronutrients. And here we need your support, because as much RUTF that we can buy, we can provide to them. When we plan to give them for at least to 10,000 kids, we are providing them family hygiene kits. These kits contain the menstrual hygiene, the cotton, the cloths, and also the hygiene kits for the families, including 5 toothbrushes, toothpaste, washing, hand wash, all the other things. And these hygiene kits we are providing to 5,000 families. We don't have enough right now, but we are looking for funding to be able to provide to these 500 families. Mosquito nets has come out as a very important need. Unfortunately, it is short in the market. We are looking for it, but we also need to support it. And we need to develop water filtration plants in each of these areas. And we plan to develop at least 20 plants in these areas so that we can provide them with safe water. Because unfortunately, as we saw there, they say that because of the flood, even the drinking water that's contains all the fertilizers and the chemicals that they have put on their crop, that has seeped into the water, and it is not potable at right now. So this is here that I will end my talk, and I will request that no matter how much you spend on the state of our tertiary centers, the national health figures will not improve. We have to work towards primary health care. These children need us. They need you. We all have to work together for these lowest income groups. I invite you to help us. I invite you to work with us. As I said, again, we are not researchers. We are trying to collect data. We have at least 10 communities right now where we have nascent communities. You can come in and work with us, take out data for yourself, write papers, get the proof of evidence, and let's prove to the government. Maybe someday somebody hears, somebody listens to us, that primary care is the answer to all our problems. And I thank you all very much for your kind hearing. Thank you.
Thank you, Dr. Naeem. It is, as always, very inspirational, and I have visited these facilities and places, so I can relate it very well. It's, as the pictures are saying 1,000 words, but it is much more than what the pictures are showing. I will open it up for Dr. Uzair and Dr. Akhtar's comment. I know Dr. Akhtar has done some work in stunting growth, and he may have some views to share. And in the chat, Dr. Naeem, there are a lot of people who are showing interest and inspiration from the work PAHCHAAN is doing, and they want to collaborate with PAHCHAAN for province and then province Balochistan.
Thank you very much. Sorry for barging in before Dr. Akhtar. We are working currently in Punjab, but we have our partners in Balochistan. The Health Balochistan is working there. We have partners in Sindh. Professor Aisha Manaz, you know very well, Kompal. We are working with them, and we have other partners, and we are working in Khyber Pakhtunkhwa as well. We are working on child protection. So PAHCHAAN, although our roots are in Punjab, but we are working all over Pakistan. Thank you.
So, Dr. Jabid, it looks Dr. Akhtar is also in the hospital. So maybe over there. So maybe we can have in the meanwhile some question from the sport. Dr. Akhtar is there. Okay, over to you, Dr. Akhtar.
Thank you very much, Dr. Naeem, for a wonderful insight and the work you are doing and your team. The one comment regarding the malnutrition and the amount of money needed to reverse that, or at least counter that, which is, you mentioned around, I think, 12,000 or 18,000. Now, you are working mostly in Punjab, and the data of Punjab was better than other provinces, I believe. I do not know what is the data for the Sindh. One comment I would say that it's very hard to turn back those students who are like older than 5 years of age. First 3 years of life, you can turn them back, their malnutrition and their stunting with some help, or the food you're doing. In Africa, they use this peanut butter model, which really got very popular. And Dr. Bhutta himself has worked on these subject quite well, and he has written a lot of paper on the Lancet if somebody interested. My question to you, that have you seen or done anything in your campuses or in your the organization, the children who is more than 5 years old or less than 10 years old? If you remember to see those 9-year-old or 10-year grade 9 and grade 10, which is Navi or Dasvi Jamaat hamare, when they become toppers, they look very thin and lean, as if they are also stunted. So that thing has something has done some work. I have done some work on it, and we noticed that if you try to do three areas, obviously one is malnutrition area, like energy. Second thing is treating their chronic illnesses, and third thing, which is more important, is the education and awareness. Um, because without education and awareness to the parents, nothing is happening. So I would like your comments on that.
Thank you, sir. You are spot on. Obviously, I'm talking about the critical period of the first 1,000 days and the next 1,000 days, which is under 5 years of age. And we have to divert all our energies if we want to develop the 90% of the brain there. But adolescence is again a neglected area in Pakistan. I have been working on adolescent health, and with my group of the International Society for Social Pediatrics and Child Health, I have found out that it is not just a problem of Pakistan or the third world countries. Even many of the middle income and higher income countries are also finding it very difficult to develop adolescent health programs. This is another extremely neglected areas. And these are, remember, looking again at my province and my country, these children are as we say, future of tomorrow. These are future of today, because these are the ones who are going to be involved in the gangs. These are the ones who are going to be involved in the drugs. These are the ones who are going to do nothing and stay home or stay in the streets. And these are the ones who can actually bring benefit to the society, as you said, through education and through their skills. So we have to nurture them at every cost. We are developing a program in the adolescent health as well, but this is we are working on the parenting, and towards we are working with the schools on child protection and on child nurturing and on child development in the adolescent area as well. So this is, but I must admit that this is not, as of now, a priority area for PAHCHAAN.
Okay, thank you. Another thing which you have mentioned, which is very heart touching, that when you try to teach something or some patients or some children, especially the children group where the parents do not have the resources, you have to not only treat the child, but also you have to, help the parents so they can bring the child to you, or if they have some deficiency. One example I can easily give you, Dr. Jabin is aware of that too, that in when there was a campaign against the TB in Pakistan, so the medicines were given free to them. But what was happening is the family doesn't have money to eat or buy their food. So they get the medicine and they sell it outside and they buy the food from them. So at the end, the organization, I'm happy to name it, in this hospital, the organization has to not only give them the medicine, but also give them resources to buy the food so they don't, sell those foods. So it is very painful that in Pakistan, especially, the systematic failure. That's what you have, mentioned. And to address that, I mean, what are the help you're getting from the government? I mean, if you can highlight, or is there anything else can be done to, just to do something about this systematic failure?
Unfortunately, as you said, the systematic failure stems not from today, but from our yesteryears. And it is not going to be resolved in a year or maybe a decade. We work with the government in different capacities in their and I'm a member of so many government committees as well. We seek their support, and we have got some support from the EPI, but the rest of the government, and also from the Child Protection and Welfare Bureau and the Social Welfare Department. But that's probably just a pinch of salt in the atta, as we call it. I don't know, just a 1 in 100 or even less. So what we are talking about, we are looking at the philanthropics, because that is the area that we still, in Pakistan, there is a parallel support system that is going on through the philanthropists, Indus being one of the primary examples. In our centers as well, we have the same problem, and that is why we have managed to work with TMSG, and we are so very kind that they have joined hands with us, and we are providing them nutrition along with the medicines. And again, the strength of our program, I say, is not the medicine that we give in the centers. It is the community awareness that we give in the centers as well as house to house, each of the households. So that is where we feel the change is going to come. So we are not talking about treating minor ailments. We are talking about preventing major illnesses.
Thank you. And the last but not the least, I am happy to contribute anything from my end, and I'm sure Dr. Jabin is also seconded because it's something community work, and please reach out to me or let me know if I could be of any help for developing any other centers in Pakistan, or any province like Sindh or other than Balochistan or NWFP. Thank you. Or Khyber Pakhtunkhwa nowadays is called.
I'm so grateful for that. And I just saw somebody talk about Gilgit-Baltistan also. We are working with
Yes.
Rupani Foundation in Gilgit-Baltistan on education and early child development. So, but not on health as much. We just had one camp in one of those areas near Hunza. So, but talking, and I'm so grateful. We had a great meeting when I was there, and we talked about the possible collaborations. And I'm actually looking forward to building up on those collaborations. Thank you very much, and thank you for being here as well.
There's a lot
Dr.
of
Jabin, now
enthusiasm in the chat about collaborating, working, and I think Dr. Naeem has put his the website link. Please go there, reach out, connect, and join hands in this important cause with PAHCHAAN and in whatever capacity possible.
I'm also putting my personal email so that anybody can just email me anything, and I'll be most happy to reply and to connect.
Dr. Uzair, do you have any comments?
So, be honest with you, like you mentioned in the beginning, tears in my eyes. So, just looking to the presentation and looking to the pictures, my condition is no different from you. So, it is so moving, so inspirational, really, and a great hero like Dr. Naeem who have taken the lead, and they are the change agent who are making the difference. So, that is commendable job, and I do not have words really to compliment Dr. Naeem. And I have in my intention, no sooner I go back to Pakistan, I shall visit his center and see if I can contribute in any way. So bare minimum. And like a lot of interest is being shown from the participant, and the address is there. I think they can contact Dr. Naeem, but simply when we met in Toronto, I had no idea about their work, but now I am fully aware what change are they going to bring. So thank you very much for introducing me to Dr. Naeem when he was in Toronto and gave us an opportunity to explore further. So we are all his volunteer and supporter. And from all of us, you can convey our compliment and thanks. So over to you again.
Yeah, and it is PAHCHAAN. Somebody is asking, and it is stand for protection and help for children. No, Dr. Naeem, aap bata dein PAHCHAAN stands for, because I made me saying it wrong.
Protection and help of children against abuse and neglect. This was the
Yeah,
actually
perfect.
started
I
off with
have this.
protection, but now we are actually we started off with the reactive protection in the hospitals, looking at the abused and neglected children. But now we are
Yeah.
focusing more on preventing abuse and neglect in the communities.
Great. So, like a lot of people are saying to connect hand, please reach out and do something, even if it is small. These वो कहते हैं कतरा कतरा मिलके दरिया बनता है, and that katra is important from our side to contribute and to make an impact. Dr. Naeem ने सिर्फ एक picture दिखाई है. I have seen that whole area, and that is not one line. That are many, many lines there. And you can imagine in this era where there's like people, I saw kids in the garbage, like just and taking out stuff so they can sell. So it is very heart touching to see it with your eyes and to see the place where they are living and where normal basic facilities of life is not available. So with this, yes,
We
Dr.
have a
Sorry, I
hand
was
raised.
just want to, yeah. Sorry, I was just going
Doc-
to, so go ahead. Sorry, Dr. Uzair.
Yeah, so there is a one hand raised by Dr. Shaukat Ali Panwar. So, give him an opportunity. Unmute yourself, Dr. Shaukat, and say what you want to say, please.
Assalamu alaikum, sir.
Walaikum salam.
I am Dr. Shokat from Interior Sindh Badin district, and I want to work with that organization because our district is deprived from government, and there is no facilities for poor people and poor kids, and there is so many kids are suffering in malnutrition. So I want voluntary work for with you guys.
Thank you very much.
Thank
Greatly
you very much.
appreciate.
So grateful for that.
So grateful to you. So that's it. So then again over to Dr. Akhtar. You were about to say something. Yes, Dr. Akhtar.
Yes, Dr. Naeem, sorry, you have mentioned something about to create or to develop a center, which is roughly 18,000 USD. Am I
18,000.
correct?
Gee, that is the running cost
Yeah.
for 1 year.
Okay, a running cost of 1 year, or is it, and how to develop a center? I mean, like you have already roughly 22 centers around, right?
No, we have 5 working, 5 under construction, and 5 in the pipeline. So we plan to stop somewhere around 15 so that we give proof of evidence and then ask other organizations to do it along with us. So right now the construction cost and the equipment is close to about 9 to 10,000 USD, and added to the 18,000, so something around 28,000 for construction, because the basic premise is that we seek to get a space from the community inside the community. So they give us space where we construct, and some of the landowners or some of the community members, they join hand and they give us a small piece of land. And I am so very proud to tell that one of the children that we started working with from the class 6 or 7, he was a beneficiary from PAHCHAAN for many other things. And as a child facilitator, he completed his bachelor's, master's, and now he's doing a job. And he had a very small place near Kacha Pakka, near Kasur. And it it was the place where his father, when he did his metric, father said, you come and work with me as a farmer. And PAHCHAAN, he wanted to study, and PAHCHAAN helped him in studying. So that boy and his father have donated a small piece of land over there, and that land has been taken up by my own class of Chemcolians 1983, and we are building a center there almost near completion, and we are supporting that center all along. So it's just the community that's working with us.
Because a lot of listeners are from North America and Canada, I mean overall, and Europe. I mean, it doesn't have to be one person to take the full responsibility. Maybe a group of friends and a group of classmates can, because 18,000 is not a big amount, as if you say so. If you are 5 or 6 people can join hands together and support your project, that is
Yes, thank you. So many good thoughts, and I hope all of this get translated into action items with all our effort. Thank you, Dr. Zafar, at the end for sharing such a powerful perspective, and thank you to our panelists, Dr. Uzair, Dr. Akhtar, and Dr. Shaukat, who joined for the enriched discussion. If I may leave everyone with three key reflection. First, community-driven strategies like PAHCHAAN remind us that real change begins at the grassroots level, empowering families and local network. And it's us, like it means me, Dr. Naeem, Uzair, and each one of you who have to work at the ground level. Second, child rights and healthcare are inseparable. Protecting children is not only a moral responsibility, but also a health imperative. And finally, this model gives us a pathway forward, one that connects policy on the ground action and international collaboration to create impact not only in Pakistan, but set as an example and as a role model for other region and beyond to practice that. At the end, I would like to say huge thank to Dr. Uzair, through APPNA MERIT, to Waleed for creating this platform, and all of you for joining us today. Let's carry these lessons forward into our own work and into our communities and provide, like, put our contribution, वो कहते हैं ना कि अपना हिस्सा इसमें डालें, तो so that it will continue to grow and continue to provide impact to us. With this, thank you so much. At the end, Dr. Naeem, we will close the webinar and we will meet everyone of you with another thought-provoking webinar next time. Please stay tuned, stay connected, and continue building this community more and more stronger. Thank you. Assalamu alaikum.
Grateful to all of you. Thank you very much.
Assalamu alaikum. Allah Hafiz.
Allah Hafiz.